so it's Rita at Gold Medical Jobs. Thanks for stopping by. It is Labor Day. Happy Labor Day. And I'm going to make it brief. I'd hoped that Mary could be here with us, but she is still seeing to her sister-in-law who had a relatively, as one of the surgeons said, a monster surgery on her heart. And he did say that to the patient, which Mary took issue with. You know, when you're pre-op, you really don't want anything more further to be alarmed about. So it is the biggest surgery they did do at this very big hospital back east. And so I think there's better words than monster. Maybe important, extensive, whatever, but not monster. Anyway, so Mary's tied up with that, being a great nurse and a great family member, and things are going pretty well, actually. So that's great. And I can't say that smoking, a lifetime of smoking, didn't have a lot to do with this surgery. It did. It did. Okay, so one of the things I think it's important to say on Labor Day is that the hospitals never close. Illness knows no boundaries. And thank you to all the nurses and doctors and technicians and therapists and specialists and ancillary staff and everybody for doing what you do and doing it regardless of what day and what time it is. So thank you very much. I had the great good fortune to spend some time with some off-duty time with two terrific nurses and to speak to one terrific nurse at the beginning of the weekend on Friday, I think. Yeah. So so here's the interesting thing. I never want to be too political, but life can be political. And so my first conversation was with a fabulous nurse that I go way back with, and she took a stand. She represented other nurses in the union, and they have a new chief nursing exec, a CNE, where she works at a fairly mid-size, I would say. I don't know where the cutoff is, 200 bed, whatever, but a full functioning mid-size hospital. And the union came in years ago, and the CNE came in months ago, and they sat down at the table and what do we need and what's going right and what's not going right was discussed, and things were agreed to, and the administration and the union came to some decisions. And when it was time to sign, late actually, there was a deadline, the CNE did not sign. And so my friend was very disappointed. Cuts had already been made when the CNE came in at a very generous salary. And what the concern there is not that she shouldn't make money, but that she should know from her staff, from her superiors, and then from her worker bees throughout the hospital, what's important, what's needed for patient safety, what are they doing right, what needs help, and so forth. And they did that, and they sat at the table, and then she didn't sign, and she failed to sign. So my friend spoke up. She spoke up, and what was a little disappointing to her was that many other nurses did not show up. Now, everybody's not working on 12-hour shifts. People work usually 3 12-hour shifts a week. Sometimes they do that extra 4. I don't know at this hospital how they work it, but I imagine since the CNE came in several months ago and got rid of a lot of the assistant managers and put charge on a volunteer basis and charge positions on the units and made cuts and gave more patients to the certified nursing assistants, and so made these changes which made life difficult, which I imagine nurses not being able to go because there was nobody to cover their patients for them to go and speak. And as it turns out, so that was on Friday. My friend went to our meeting. Not a lot of people showed up, but she did show up, and she was calm and direct and said, oh, I forget the term, non-disclosure or something. You know, she made a statement that it was inappropriate to not sign when you said you were going to sign, and to be late to the deadline date, and to hold everyone hostage waiting for you, and then to not sign. So she spoke up. And I'm sure other steps will occur, and they'll probably go back to the negotiating table, or I don't know. I don't know if there'll be fines or what will happen. But I have complete respect for this nurse, and I don't know both sides of the story, but patient safety has always been, you cannot be an RN and not be a patient advocate. And so that was that. And then that was Friday. And then on Saturday, two nurses came over. One is a professor, and you actually have seen her. Her name is Sue, and we spoke when I was in the Northwest visiting her in Canada. That was such a good time. So she is a professor, and she's done many years of clinical ICU and interventional radiology. Kind of mentioned that to me, and then I actually went in that direction at one point. Great area, interventional radiology, and then also cardiac cath lab. Two great areas to work in. And so she was visiting with her husband, and another nurse who Sue had taught, one of her students, has been working for quite some time now as a cardiac nurse. And of course, I know these ladies socially, but it's fun that we're all nurses because we get to speak about something that we love. And as it turns out, that nurse is so busy doing her job and not feeling completely informed on all the pieces, but also keeping her patients safe, keeping her unit safe, is why she didn't attend the meeting. So that was very interesting, and kind of what I suspected. So I don't want to speak too politically, but I do want to say I so appreciate everything everybody does out there on Labor Day, how they labor, and I understand why. It's your passion, it's your profession, and it's your job. So so I am grateful to everybody right there with you for many years. Now I have a little bit more of a pick and choose schedule. Lucky me, but took over 6 decades to get here, and I'm not done yet by any chance. So that was something I wanted to say. Two nurses work at the same hospital, completely different perspectives. Actually both work as staff on the units, and both are members of the union. And one perspective is that there's no way I can leave. I didn't get enough information. I have to stay here with my patients. And the other one is, I'm in a leadership position in this union, and I saw something really wrong occur. I must speak up. So, so that was really interesting. And then the other thing is, in addition to everything else, and this is kind of in any profession, is the updates. And so, so they're annoying. You're supposed to squeeze that in on your work time, but you never can. And so people are out there keeping up their credentials. For one, if you carry a BLS or an ACLS or a NALS or PALS or whatever, and then all of the tutorials that occur that have to do with ethics, that have to do with your actual discipline and specialty. I encourage you to be as on time with that as you can. It's annoying. It's more time consuming always than you think it is, but it also refreshes you on policy and standards and practices and updates. So so that one friend of mine, we sort of socialized for a while and sat by the pool and noshed out on some lovely cheese board and charcuterie boards that I made. I was quite proud of. And then out comes the computer, and we're like, sure, we know you need to get this done, by Labor Day, and it was already the 31st. So, so we said, go right ahead, and we had fun bantering about what answers we chose, and we didn't agree on every answer and why we chose them. So I don't know. I just encourage you to get it done. I know you have to do it, so it's there anyway. We had fun doing it. I'm not sure she finished because probably everybody was trying to finish in the last 2 days that it was needed, and there were long pauses between the tutorials and the trainings. So that was kind of fun. And I don't know what else to tell you except happy Labor Day. Tomorrow is my hike to Yosemite. Actually, it's a long drive and then hikes. And I've packed moleskin and first aid and water bottles. And I'm really excited to do that. But I won't, unfortunately, be able to see you because R&R is what it should be. So that's my R&R this coming week, Tuesday to Tuesday. I will see you hopefully on Wednesday, the 11th, okay? And then I will invite Mary back. Hopefully her sister-in-law's well on the mend at that point. She had her surgery on the 30th, I believe, the 30th. So keep a good thought for those having surgery in these summer months and those not feeling well. If you have any of those people, they're in my broad prayers, and I always pray for those suffering from cancer and grief, and wish them the best and wish them strength. And I'm grateful, knock on wood. I look kind of a mess today because I've been working out and to avoid injury and illness. It's one of the things I do. All right, everybody. Sorry if I came in off time schedule. I was kind of waiting for 5 o'clock Eastern time. I thought, what was that? 4, 3, 2. No, 4 o'clock Eastern. I'm late at any rate. I was going to be here at 1. It's almost 2. My apologies. I hope you catch what you can. Let me know what you'd like to hear about. My goal is to just start talking about facts, clinical facts that occur, and that'll be great fun to do with Mary. Your most memorable experience treating someone for pain, your most memorable experience treating someone for whatever. We'll just go through it, diabetes and surgical and the funniest things that ever happens, the scariest things that ever happen, your proudest moments. So we're going to throw some of those around, banter about that, and talk like nurses do. We just can't help ourselves. We're fascinated with what we do and privileged to do what we do. So we'll do some of that. Okay. Happy Labor Day, everybody. I'm going to sign off. Thank you very much.